Children can help plunge a clogged toilet only with close adult supervision and clear safety rules. Start by assessing the child and the situation. If the child is at least about 8 years old and comfortable with gross tasks, have them wear long gloves and closed-toe shoes and stand on a stable, dry step so they can reach the bowl without leaning over dangerously. Show them how to position the plunger so it seals over the drain opening, and emphasize slow, steady pressure first to create a seal before attempting strong thrusts. Teach a safe body stance with 1 foot forward and knees slightly bent to protect the back and avoid sudden slips. Explain hygiene steps. Keep hands away from face, remove gloves without touching the outside, and wash hands and arms thoroughly with soap and warm water for at least 20 seconds afterward. If the clog resists after a few firm plunges, stop and call an adult to try a different method to avoid splashing and injury. Common mistakes include letting a child try without supervision, which risks injury and spreading germs, so always stay close and guide each motion. Another issue is using the wrong plunger or poor technique, which causes splashing. Fix that by using a flange plunger and teaching the seal then pump routine. A final concern is inadequate cleanup and hand washing, which spreads bacteria. Have the child remove gloves properly, dispose of contaminants, and complete a supervised hand washing routine immediately. We run bighomeprojects.com, where we connect homeowners with local contractors and provide a community space for practical discussions about home safety tasks like this. We help contractors find work by allowing them to participate in community conversations and showcase their advice and services.